Hi, my name is Nidhi Sharma. I'm a women's health physical therapist here at FuncPhysio Physical Therapy. Today we're talking about groin pain in active young women. So I see a lot of women who, if you're a young woman and you're having groin pain with biking, with spinning, with hiking, with lifting, with carrying, with any strenuous activity, if you're having consistent groin pain and you're ignoring it, or you're going to an orthopedic physical therapist who's teaching you how to stretch the groin, how to do stretches for the flexor muscles to improve that mobility, and it's not improving, okay, if it's not responding, or that it responds and it keeps coming back, it responds, it keeps coming back, then what could it be? So we have some important connection between the pelvic floor and the groin. So let's look at the model here, and I'm going to just take these organs out. We don't need to look at them. Okay, so here's the pelvis, and we are looking at the pelvis from the front. So this will be your pubic bone, this will be your lower back muscle, this will be your tailbone, and if we tilt this inside, you see the big hammock-like muscle inside the red thing is the pelvic floor. The hip joint would be here. Okay, so hip joint comes out of here on both sides. Now, usually the groin pain is somewhere around this ligament. If you see this big rope here, usually the groin pain is somewhere around here. This will be the hip joint here. So the leg comes out of here, and this will be the groin. Consistent pain in the groin can be due to pelvic floor dysfunction. So if the pelvic floor has too much pressure because you're sitting on it with spinning, with wrong posture and pushing down, or if you're hiking with wrong shoes, or if you're doing something with the wrong posture, the pelvic floor can be strained. When pelvic floor is strained, often the compensation comes from the hip muscle. So pelvic floor cannot do its job. So the body will try to find some other way to do that job. And oftentimes that other muscle is the hip flexor. So the muscle that lifts your leg from here comes through here, and usually that muscle is what body uses to compensate. It's also possible that under this ligament, a bunch of nerves pass through. They come from your trunk and they pass through the groin under this canal, under this little opening here and here, and then they go into your pelvic floor. They go into the pubic bone, they go into the vulva, they go into the other places in the pelvis. So prolonged groin pain, prolonged amount of pain here, has a very high chance of irritating these nerves that can cause pain in the pubic region, vulva region, or even in the perineum region. So it's very important to handle this groin pain because it has a possibility of leading to pelvic pain, pubic pain, vaginal pain. On the other hand, if you have pubic pain, vaginal pain, or pelvic floor weakness, you're much more likely to get the hip pain and the groin pain because body is going to look for compensation from somewhere. So the gist of the matter is groin and pelvic floor are very deeply connected. Okay, usually one area will work for weakness of the other. Also, if one area is hurting for a long time, it will leak to the other pain. So pelvic floor pain, leaking, pain with sex, pelvic pain will usually lead to groin pain in long term, and same thing, groin pain in long term will usually lead to pelvic floor pain or pelvic floor dysfunction in long term. One will usually not get better without the other. So you may get some relief from the groin pain, but as you start going to spinning again, the pain comes back. Okay, so it's very important to look at pelvic floor because it is so closely connected to groin. Also, because a bunch of nerves from the groin region go into the pelvic floor region, and that nerve connection is very strong. So if you have groin pain and pelvic floor dysfunction, or have either one which is persisting and not going away, you should consider a pelvic floor physical therapist who also works with orthopedic patients. So I work with orthopedic patients and pelvic floor patients. I have double specialty. You should look for somebody who has that kind of background, who can put these pieces together and treat you in a more holistic way.